Okay, first of all, you've checked your Cardex or your prescription to see what's the rate of the IV and the drop factor, or you choose a drop factor that's available to you and you calculate, right? You prime your IV, or if it's primed already, you will check to make sure there's no bubbles. It's properly primed, and everything seems to be good here. So I have my needle, my catheter. I have my NS syringe. There would be a cap on this as well. And I have my NS lock and my dressing. So I have 3 tampons, alcohol tampons, gloves, and also a tourniquet. Okay, so this time around, this is what I will do. I will open my equipment first. So I will open my dressing, catheter. I've opened my catheter. What I will do is slide the gray part and the white part ever so gently. Something like this. And put back into my container. I'm going to open my 3 swabs. Of course, for exam, we will ask you only to use 1. It's not necessary to use 3. So now that everything is open, I believe I have a piece of tape. You can't see that, but there's a tape here on the side. I will apply my gloves and look for a vein. Or you could look for a vein before opening all your stuff, which is what I did the last time. So apply a tourniquet. The tourniquet has to be 3 inches above your insertion site, approximately. Oh, this gentleman has lovely veins, so I'm going to poke here. Wash, zigzag, downwards, zigzag across, and then finish with a circular motion from middle to exterior.
So when you think about it, the size of your disinfectant, like it needs to be about the size of the dressing, because you need to cover your IV. You don't have germs underneath.
Connect this. I need to flush this. Okay. Again, going in at approximately a 30-degree angle. Penetrate. Take deep breaths, sir. 1, 2, 3. I have blood. I push it in ever so slightly, a little bit. I hold on to the white part of the syringe of the needle. Sorry about that. I push the gray part as I keep my hand stable, the white part stable. Push the gray part all the way through. Pull on the white one. You heard a click. Once you've heard a click, means that you can remove your needle part. This has been done. We've gotten blood. We can remove the tourniquet. Okay. I will clamp the needle. Remove the cap off the NS. Remove the cap off the catheter. Connect both. Open clamp. Flush. I clamp it again. Then I can apply my dressing. You see that my fingers here are free? We applied the same method Susie said. We make sure we align the catheter with the vein and not the arm per se. Okay, this little part here. And then we can remove the paper part. I like to connect the IV before taping everything. Although you can tape before connecting the IV, it is not a problem. If you want to scrub the hub here, you can. Push and twist. My IV is connected. I'm going to continue taping. Okay, I would write. Can I write? Can I borrow this for a second? Thank you. 21st, 02, 03 km. Thank you. My extra tape would be here, and I would apply it slightly higher on the arm. Okay. Now that this is done, although the finishing touches, you could check your IV first or after. I'm not too picky on that. You want to make sure it's working. If it's not dripping, go through your IV line, because there are several clamps. Slide clamp is open, side clamp is open, ruler clamp is open, so that means something. Ah, this clamp is clamped. Okay. Is it dripping? Yes, it is. At this point in time, then you could come here with your watch and calculate the drops per 15 seconds, according to your calculation. Okay. Good? Et c'est tout.